There's been a lot of development in personalized medicine, particularly in the last 5 to 10 years, particularly in the field of oncology. There's a lot of publicity and a lot of things that have been made public about the role of genetic testing in both screening as well as in treatment of oncology. And we see that in breast cancer in particular is probably the first one that comes to mind. It's pretty much the standard of care that genetic testing is done at diagnosis of breast cancer to detect the specific genetic presence within the tumors. And then also in terms of screening, a lot has been mentioned, and a lot of folks, although it may not necessarily be standard of care yet, a lot of folks have taken it upon themselves to have genetic testing performed to see if they're at increased risk for cancer. And, of course, probably the most prominent example of that is Angelina Jolie, who, had prophylactic surgery, in response to some of the genetic testing. And then even more closer to home, one of the parents of a classmate of my daughter's also had prophylactic surgery because of the strong family presence of breast and ovarian cancer, and then also the genetic testing that she had as a precaution for that. So I think a lot has been done in terms of screening and in treatment of oncology in particular. And there's been, medical studies and tests done in terms of detecting the efficacy of medications in treating a number of different disease entities, including diabetes and hypertension, which is so prevalent in many communities. I don't think it's really taken off to the point where it's all standard of care yet, but there's been a lot of advancement in the last decade. Well, I think in terms of the literature, I know a lot of that was done. This might even be more than 10 years ago. I don't know how long ago, but with tamoxifen and treatment of breast cancer. I think they found that there were a significant percentage of folks that did not respond to treatment. So I think that was a major advancement in that. But I think there's still a lot of work to be done to show the cost effectiveness of it.